Hi, this is Hager Solomon presenting the dental paper titled Matrix Glub Protein Deficiency Impairs Nasal Septum Growth Causing Midface Hypoplasia. The goal of this experiment was to illustrate the primary causes of midface hypoplasia in MGP or matrix glub protein deficient mice. The primary cause was found to be impaired growth of specific bones due to abnormal mineralization. What was known previously from other research was that both genetic and environmental factors lead to abnormal growth in orofacial skeleton. Often birth defects are associated with craniofacial abnormalities, which in turn cause disruption in other parts of the body due to disrupted biological processes which cause the abnormalities. This experiment specifically looked at mice with Keutel syndrome, which is a genetic disease caused by loss of function mutations in the matrix glub protein gene, also known as the MGP gene. Patients have ectopic calcification of cartilaginous tissues as well as impaired midface development. In this experiment, they specifically used mice that were MGP deficient as well as mice without these deficiencies to compare and contrast the differences in gene expression both phenotypically as well as in terms of the biological processes such as mineralization. They used X-rays, CT scans, PCR analysis, and other methods. It was found also that in vivo MGP promoter is very active, specifically at the cranial sutures, cranial basin crevices, and nasal septum. In Figure 1, we see that the researchers looked at both MGP and osteocalcin deficiencies. Osteocalcin is also known as BGLAP. And they looked at what these deficiencies and what they had in terms of like the effect on craniofacial development. When compared to the control mice, it was found that MGP deficient mice had severe blunting of the snout as well as a rounder face and a wider face. There was also intense radiopaque areas above the incisors as well as a sphere overbite. What was interesting was that the BGLAP deficient mice did not have any of these issues, and you could see from the green and blue lines over here. In Figure 2, we can see that in order to figure out the role of MGP promoter activity in the calcification in the nasal septum, the researchers stained the mice heads with XGAL for beta-galactosidase, which is from bacteria, and this expresses itself in tissue where MGP promoter activity occurs. It revealed via staining that the MGP promoter expression is found in all the cranial sutures and most strongly in the lambodial and frontonasal sutures, which is shown right here. Frontonasal. Other sutures, however, did not have any signs of anomalies in MPG deficient mice, which was also interesting. They were also found that in Figure 3, that via staining, that MGP promoter expression is found in all the cranial sutures. And we could see in these sutures right here. And here these sutures show that there was no change and no closure, or there was closure, which was same in both the control and the MGP deficient mice. It was also found in Part E of Figure 3 that ectopic mineralization occurs in the nasal septum of MGP deficient mice when normally there remains this area remains unmineralized throughout life, and we could see it right here and here. In figure 4, we see a comparison of mineralized septal cartilage in MGP deficient and unmineralized septal cartilage in control mice, which is shown here and here at 5 weeks of age. In figure 5, the researchers wanted to know whether local expression of MGP in cartilage corrects the midface hypoplasia in MGP deficient mice. And to figure this out, researchers generated 2 transgenic lines that expressed MGP under a certain promoter called COL2AL. In part B of figure 5, this is when PCR was analyzed via real-time PCR in mice with both MGP deficiency but also had the promoter COL2AL. Interestingly, these mice had a 6-fold increase in the MGP expression in the nasal septum when compared to their litter mates with just an MGP deficiency. This increase in expression, however, was not enough to prevent arterial calcification, as shown in Part D of Figure 5. In parts F and G, we see that it was also found that there was no ectopic calcification of the nasal septum, and the lengths of the craniofacial structures were normalized. This all suggests, of course, that MGP deficient mice expression of the MGP promoter locally can correct midface hypoplasia. Another issue that was found in MGP deficient mice was that they have a shorter nasal septum, which we could see here and here in figure 6, part A. And the graphs here show the comparison of the lengths of the ratios of the lengths. And we could see these are compared over here. In figure 7, we see that the researchers attempted to understand why nasal septum shortening occurs in MGP deficient mice, and it was found that there was no difference between the control and deficient mice when it comes to septal chondrocytes, which they believed could be a cause. But they did, however, find an increase in the TUNEL positive immature chondrocytes, but not much else. Researchers also wondered if nasal septum calcification in MGP deficient mice was related to growth plate cartilage mineralization, and to test this, they compared the expression of chondrogenic markers in normal and deficient mice and found that there was no difference in the mRNA levels, which you can see seen in figure 8. Notably, and we could see this in figure 9, that there is a prominent amount of minerals found in the nasal septum at the location where at these locations where the minerals are deposited, growth lines increase. And this was seen via X-ray spectroscopy. It was found that these minerals consisted mainly of calcium and phosphorus, and this is shown in figure 9. In figure 10, we could see that these figures illustrate the use of MGP deficient hype mutant mice, and these hype mice were found to have a 50% reduction in phosphate levels in serum, and in turn had poor bone and tooth mineralization. When these mutants were generated, where a double mutant was generated where they had an MGP deficiency as well as hype, we found that the reduction in mineralization was persistent, and however, the serum calcium levels stayed the same. It was found that within these double mutants, there is an absence of cartilaginous nasal septum mineralization, which was confirmed by both micro-CT scans as well as histology, which micro-CT scans over here and the histology right here. In part E, we can see that Also, the maxillary and palatine lengths were normalized compared to just MGP deficient mice. And this confirmed some of their ideas as to how craniofacial hypoplasia can be corrected. And as we could see from all these figures that illustrate the findings of this experiment related to mid-face hypoplasia. Thank you.